All right, so this will be my last recorded lecture for the semester. This lecture has remote location, first aid, as well as emergency moves and triage. And so you'll use this lecture to complete the last 3 study guides. All right, so remote location is when additional medical personnel are not going to arrive in the next 10, 20 minutes or even longer, or you're in a location that you don't have coverage and you can't call, or you're in a remote location where they can't get to you when the victim. So all of this makes what you're going to do just slightly, well, not everything you do slightly different, but there are some things you'll need to do a little bit differently. This can be in rural areas, remote activities like hiking and camping and boating, and then also if there's natural disasters, you may have a situation also where there's multiple victims. So that's also can be an issue. All right, so if you are going into a remote location, don't go alone. Make sure you leave a map and tell someone where you're going to be. Make sure you have a communication device that will work in that location. You might have to have some type of radio if cell phone coverage isn't something you're going to have out there. Make sure you have a first aid kit and food and water that are needed. The nice thing is now these life straws you can get, and you can turn any water into water that can be drank using this straw or some type of water for purification system. Know what the weather's going to be like, and to make sure that everyone is not using alcohol and drugs in a remote location, which can increase the chance of having an emergency. In your car, when you're going to be in remote areas, it's always good to have flares, some kind of a sleeping bag or blanket. I don't know about the extra engine oil, but the toolkit, jumper cables, chains, shovels, and sand in case you get stuck and you need to use the shovel or the sand to move and to get some more traction. And then again, I don't know about de-icer for the fuel line, but and then water as well. First aid kit, so all kinds of things that you might not have in a first aid kit for just in an urban area, especially some of these things that would be an over-the-counter medicine to help a situation. Anti-diarrhea, anti-nausea would probably be the 2 important things, as well as like a Benadryl in case someone has an allergic reaction. And then this would just be a list of things you'd want in that first aid kit, including scissors, tweezers, knife, thermometer, flashlight, all kinds of bandages, triangular bandages, splinting material, irrigation, syringe. I don't know about a dental filling kit, but I know that friends who do a lot of remote activities have one of the backpackers, their entire backpack is first aid kit, and they have everything from medication to EpiPens, and they've had wilderness first aid training, and just they have about everything you could possibly need to have a pop-up medic tent. Okay. If you have a victim and there is some elements of weather, you can erect a shelter for the victim. All of these work. This is definitely very protected, but a little bit claustrophobic, down into the packed snow, and then you can have a covering over it, and this will help to keep them warmer. My dad and I, one time, we went out and dug into the snow and made like a little nook to sleep in, and it was pretty warm till about 2 a.m. Then we all went inside. But all of these, one of the things that I would do in addition to putting the cover over them is to put some kind of barrier between the ground and the victim so that they don't get cold and lose heat to the ground. If you do have to leave the victim alone, So the victim, you can't move them, and you have to go to call for help. You need to leave a note with the victim explaining that what you went to do, and that you're coming back with help, so that if they go unconscious or they are unconscious and they regain consciousness, that they know what's going on. Also, if someone finds the victim, they know that you have left and should also be found. And then you take a note on you about the victim, because if something were to happen to you on your way out of that remote area, say you fell and you were unconscious, unless you had a note on you saying that there was a second victim and where they were, the responders would have no idea to look for someone else. So if it's just the two of you, that's what you need to do, a note on each person, so that if anything happens, they know that there's another person out there. Obviously, you would want any kind of bleeding to stop as soon as possible. And because of the time until medical care gets there, it's more likely that you'll need a tourniquet to stop a severe bleed. You just can't wait. Applying a tourniquet, you would apply it using fabric or a strap, and then you can put a stick in, make a knot, and then put the stick through that knot, and then twist the stick, and that will tighten the tourniquet. And then you need to tie with another strap so that the stick doesn't unwind, and then allow blood to flow back to that area, because once the blood flow has been cut off, it needs to remain closed. Normally, when you're treating for shock, you don't give them any fluids, but because of the delay in care on a remote area, that you can give them small amounts of fluids as tolerated if the person's responsive and can swallow. If they're unconscious, you're not going to give them any fluids. All right, so there's a few different types of emergencies we're going to talk about: snow, desert, lightning, and altitude. And we're just going to cover a couple little things on each one. Snow blindness, if you're not wearing eye protection, the glare from the sun off the snow is blinding, and you can get eye sensitivity, headache, nausea, and then they lose the ability to see. This usually recovers in 12 to 18 hours, but that's a long time to wait for your vision to come back, so it's best that everyone is wearing eye protection. In the desert, it's actually surprising how much water you need in a very dry climate. So 3 to 5 gallons per person, and that's an adult. And so if you can't carry that much water, then you have to have some way of purifying water, and there has to be a water source where you're headed. Lightning strikes. I like the first comment, the first bullet here. 1/3 of the victims die, but 2/3 don't. But it is an electric shock, and the electric shock can depolarize the heart, basically like an AED, and stop it from having that normal electrical activity. And then hopefully it will restart on its own, but it may require CPR to get the heart started again. Altitude sickness. So it's important that when you're going to altitude that you ascend and descend slowly, maintain good hydration, and if they're going to very high altitudes, they should have oxygen with them for those high altitude levels. Without the driving pressure, people will get less oxygen from the air. If you do have someone who starts to show signs of altitude sickness, headache, dizziness, fatigue, shortness of breath, lack of appetite, general malaise, not feeling well, that could be acute mountain sickness, and they need to rest and probably descend at that point. Severe altitude sickness will cause shortness of breath, inability to walk, decreasing mental status, and that person definitely needs to descend to a lower altitude quickly. Well, not very quickly, but within a short period of time. One of the things that can develop from altitude sickness, which is more severe, is pulmonary edema, which means fluids collecting in the lungs. They'll have tightness in the chest, persistent cough, and shortness of breath, and confusion and irrational behavior. So that is a sign that the altitude sickness has progressed and is very critical. You can also have cerebral edema, which is swelling inside of the brain and the skull, and that also can be a very critical situation and will affect their ability to think clearly. All right, moving on to rescuing and moving victims. So the first thing you do, you come to a scene and you check the scene for safety. It is not safe, then you don't enter. And again, you wouldn't enter an unsafe scene to move a victim because then you might have just become victim number 2. But if you do need to move a victim, then for example, if you need to move them so that you can do CPR because you need that person to be on a flat, hard surface, or if they're in a dangerous area and you want to move them away quickly because you're already at the scene. Again, if you see that the scene is unsafe, don't enter. But if you're already there and you realize it's unsafe and you need to move them quickly, then move them quickly. So how you're going to move them depends on how fast you have to do this and their condition, and are there other people or equipment that you can use to move them safely, and just how strong are you and can you physically move this person. So that's all the things you're going to think about. You know, if you have plenty of time, then you're going to get a backboard, you can get people to help you, and you're going to move them safely. If you don't have a lot of time, then you might be just grabbing under their shoulders or their ankles and dragging them. And in some situations, I point out that you're just not going to be able to move someone. If they're very heavy and in a really awkward place, then it's going to be really hard to move them at all, and maybe impossible to move them. All right, do everything you've been told. You lift with your legs, not your back. You keep your feet shoulder width apart to have a nice sturdy base. You can keep your back straight and then lift with those legs, and don't lift more than you can handle. Also, some other things would be keeping the load closer to your body. So if you're trying to lift someone, be very close to them so that the load is close to you as you lift up. And then also as you're walking, if you have to carry them a distance, you don't want to cross your feet over each other. You want to like do a little side step. So side together, step together, step together, not where you're grapevining, where you're crossing one foot over the other as you're walking. That's actually a pretty risky way to trip yourself, and then you fall with the victim. So if you're alone, you're going to drag. So you can, if you have an unresponsive victim and you're alone, you can do a shoulder drag, which is you crouch down at their head and put your arms underneath their armpits, underneath their shoulders by going in their armpits and around the chest, and then lift them a little bit and drag them backwards. You can also do a clothing drag, which is, again, same thing, but instead of going under the shoulders and putting your arms in their armpits, you gather up the clothing on the top of the shoulders and the back of the neck, and you drag the clothing. That will kind of pull on their neck in the front, and it's kind of uncomfortable, but it's for a short distance. If you have to go a longer distance, it would be great to have a blanket, and you do kind of a log roll to get them into the blanket, and then you can just grab the blanket and drag that. It's probably one of the best ways to move someone if you do suspect a head, neck, and back injury and you don't have time to do a backboard, because the blanket kind of works as a sling and keeps them as straight as possible. If you have someone who's heavier, it's going to be really hard to do any of those previous drags. The blanket would be pretty good, but you can also, if you didn't have a blanket, grab at the ankles, and you can drag a much bigger person by pulling their ankles, because you can lift their legs up. That's going to be an issue though if there's any kind of stairs or anything where they're going to be bumping their head. It would be really not very safe to do an ankle drag in that situation. If they have a head, neck, and back injury, I mean, you don't want to do an ankle drag when they have a head, neck, and back injury. But again, if they're in a dangerous spot and you can't move them in any other way and you don't have any equipment or anybody to help you and you're worried and think you have to move quickly, then you might have to do an ankle drag. It just wouldn't be your first choice. If they're responsive, you can do a walking assist, and a walking assist is, the important part about the walking assist is that you stay close to the victim and you have 2 points of contact. So you can see here they're holding their hand or wrist that is over around the rescuer's neck, and the rescuer has their other hand around the victim's chest. So there's 2 points of contact, one here and one here. And that way, if the person does go unconscious, they have the most control over guiding them to the ground safely. This can be done with a responsive or unresponsive victim, actually. And if they can't be dragged, you can do what's called a pack strap carry. And you can see how the rescuer is leaning forward. So first what they did is the rescuer squatted down, bent their knees and squatted down a little bit. And then the victim was either placed or guided to their back with both arms up over the shoulders. The rescuer is going to hold both arms. And so it started with them squatting. And when they stand up and lean forward, it will lift the feet of the victim off the ground. So it's really just you squat down to get them on the back. And when you stand up and straighten your legs and lean forward, it lifts their feet just enough for you to be able to carry them out. You can do the piggyback carry, but I would suggest the pack strap carry that we just looked at instead of the piggyback carry, just because if this person shifts their weight or becomes unconscious, you can see how the rescuer only has the legs and this person could just fall backwards. Whereas if you go back to the pack strap carry, the rescuer has a good hold on the victim, whether they're conscious or unconscious. So I like the pack strap carry the best out of those 3 types of carries. If you have 2 people to help, you can do this one right here, which is the 2-person, where's my mouse? There it is. The 2-person seated carry. And so the 2 rescuers have locked onto each other's wrists. And so they basically became the bottom of a chair and their arms behind the victim are exactly the same. They've locked onto each other's wrist or forearm, and then they have a nice support. If this person were to go unconscious, they would just be sitting in this chair made by these 2 people and they'd be fine. But if they are conscious, they can put their arms around the victim's neck to kind of just give them a little more support. So you can do a hammock carry, which is you have several people, depending on the size of the person. It's important to have somebody at the legs, someone at the pelvis, because that's a good hinge point to keep them straight, someone at the chest, and then hopefully someone else at the head. That would be 4 people, and sometimes you need more than one person here at the chest and the body. So you might have 3 people here, 1 at the legs and 1 at the head. That would be 5. 6 people is hard to fit around a single person. So usually like 4 or 5 would be normal. I guess one of the things on the on this type of a lift is everybody has to lift at the same time. And so again, be really clear when you say lift on 3, or I'm going to count to 3 and then say lift, and everybody lifts on the command lift. That way everybody stands up at the same time. And if you all kind of lean in a little bit, it makes it easier and no one's being thrown off balance. So everyone just kind of leans in and pushes off each other to stand up. All right, now we're going to talk about some other situations. So if there's hazardous materials, so I'm just going to give you a couple key points about several different things, just because if you've thought about it, these things will stick in your head, and I hope you never ever have to use them. But if you've thought about it once, you'll remember it. So if you did come on a scene where there was hazardous materials, one of the important things to do is to get bystanders upwind. So we don't want them downwind. This has happened. There was a chemical spill, there was gases, and they moved all the bystanders downwind and everybody got sick. So you move them upwind, away from contamination. Also, there'll be a couple different zones, and it's important that you stay in the cold zone. The hot zone is where the contamination is. When someone leaves the hot zone, they'll go into the warm zone where they will get rid of all their gear that's contaminated. And once they have done that and are decontaminated, they can come out to the cold zone where there is no hazardous material. So it's important that people don't come in and out of the hot zone to the cold zone without getting decontaminated. All right, so water rescue. You need training to do a water rescue where you enter the water to get the victim. This is not something that's easy to do. It depends on whether the victim is conscious and unconscious, just how big they are, how scared they are. It's all going to play into how that water rescue is going to go. And again, you're not going to be trained for this. I don't recommend that you do this at all. Sometimes when people are a victim in water and they're scared, they will climb over their rescuer and can actually end up drowning the rescuer trying to get themselves out of the water. So we go with the reach, throw, and row. I know it says reach, throw, go, but I'm going to go reach, throw, row. So try reaching out to them with a stick or a hook, your branch, your legs, your arms. Reach out and try to pull them in. Throw would be something attached to a rope. Cooler will float as well, so you can throw that out. If they're in a river, you want to make sure that you throw it upstream of them so that the current then brings it down to them. If you throw it at them, by the time it gets to the river, it'll be moving away from them already. So throw it up above them. And then I call this row. National Safety Council calls it go. But basically, if you had some kind of a boat or something that you could get out there, you still don't want them to tip the boat. So it'd be good if you just use that boat to row out, to throw something to them, and then drag them in with the boat. It's hard to get someone into a small boat without tipping it over. But you can go out with a kayak and have them just hold on to the back of the kayak and kick, which makes their legs come up so that they're not like an anchor and causing a lot of drag. So if you can just get them out to hold on to the boat, and then you can tow them back in. If you are stranded in cold water, you want to basically go into the fetal position to help maintain your body temperature. You can, if you have more than one person, you huddle again to maintain body temperature. Ice rescue, there's actually a really good video online about a guy demonstrating how to get out of after falling through the ice. And so one of the things that he talks about is after you've gotten into the ice water, if you start to kick your feet, it will cause your legs to move behind you, and so that you're flat on the water. And then once you're in that position, in the flat position, because you're kicking, you can kind of try to swim, and that like a seal out of the water and pull yourself onto the ground. So most people want to lift themselves out, and you just end up breaking more ice. But instead what you do is you kick your feet to get yourself flat in the water, and then you basically try to seal, like a seal, swim with your arms to pull yourself straight forward onto the ice. And then you keep moving that way until you get to an area of thicker ice where you can actually get up and move. So avalanche, one of the things that, a couple of tips for surviving an avalanche would be, is you see the avalanche coming down, you want to run to one side or the other instead of down in front of it, because it will catch you. So you don't want to run down in front of it. If the avalanche was coming this way, you would want to run in this direction towards the edges of it. There will be less snow on the edges, so you won't be buried as deep. And when people start looking for victims, they will start on the edges. So the closer you can get to the edge of an avalanche, the better. Tip number 2 is if you do have a ski pole or hiking pole with you, hold on to it tightly, and then you can kind of push on the snow and maybe even have that pole come through the snow so that people can see where you are. This is after the avalanche has stopped. Then you start poking around with the pole if you can. And the last tip for avalanche is if you were in the snow, it's very hard to know which direction is up. People get very confused and end up trying to dig sideways or to dig down, which is not helpful. And so what they say to do is to make a little space around your mouth and then spit. And the spit will go with gravity. And so you'll know which way is down depending on which way the spit went. All right. Ooh, this is a long one. So mass casualty just means that there are more victims than responders. And when there are more victims than responders, you have to make choices. And so there's all kinds of things that could cause a mass casualty incident. And so a couple things differ when you're dealing with a situation where you have to make some choices that might, whether or not to give one person care, who to go to first, what you can do. Okay, I'm going to skip over this. We've already done all this. We're going to skip this as well because packaging and transport is not something you do. That's something that an emergency responder would do. But if you did collect any information, like you did a sample history on someone while at the scene, make sure that that information goes with the victim. That'd be your extent of packaging. You will not have these tools to do an extraction, but I want to make sure that you understand that a car is stable when it's on all 4 wheels. And if it's not on all four wheels, then it can move. And so you don't want to enter a vehicle that is turned over. It's probably, if it's completely flipped over like this one, it's more stable than if it were on its side. If it's on its side, it's very likely to either go to its roof or to its tires, and you don't want to be crushed by that vehicle. So you do need some assistance with any kind of an extraction with an unstable car. All right. On a multiple casualty incident or large scale emergency, it usually starts with bystanders showing up, and these bystanders are going to fill all of the important roles of the scene. And eventually, people with training will come and take over, and these bystanders will be replaced. And eventually, when everyone is present at the scene, you'll have an incident commander who is in charge of the situation, triage officer who's tagging and supervising triage, treatment officer who's working with the medical supplies and actually treating the victims, a staging officer who's in charge of making sure resources are distributed where they're needed, and then a scene safety officer. So there's 5 roles. This is 4. There's 5 roles, and eventually you'll have 5 professionals on the scene doing this, but when the first person shows up, they're kind of everything, and they start down here, making sure the scene is safe. So the first person on a multiple casualty incident is making sure the scene is safe and that no additional victims are added to the list. So on an emergency, on a multiple casualty incident, you're not going to help everyone. Your goal is to decrease time until advanced medical care gets there and maybe help 1 or 2 victims. You do need to make sure that your job may be just to direct traffic, because you don't want to stop traffic. The reason you don't want to stop traffic is the ambulance is coming in that traffic. So you need to divert traffic probably, but you want to keep it moving so that the ambulance can get there. And then what you're going to start out with doing is triage. And if you, hopefully, I usually keep ribbons or pipe cleaners or pens in my first aid kit. Pipe cleaners and ribbons are probably the best. Sometimes tape is fine. Different colored tape would be really good. You could put it right on their clothes. Because once you do a triage, then You'll label people based on how soon they need care, and that stops the next person who gets there. They don't have to go through and assess everyone again. They go to the first person they see that needs immediate care. So hopefully you can go do your triage in about 30 seconds per patient. The categories are going to be minor care, delayed care, immediate care, or non-salvageable deceased. And so minor care is they can walk, but they are wounded, but they are okay to move over to a first aid area. Yellow means non-life-threatening, but they can't just walk away over to the first aid area. Red means they have a life-threatening condition and need immediate care. And if they fail to breathe on their own, after the airway is opened, then they would be non-salvageable. And so on a multiple casualty incident, you don't start CPR unless everyone else is either yellow or green. And then you could go ahead and start CPR. But if there's other things going on, you don't start CPR because you can't leave that victim. And if someone else was doing okay and then starts to get worse, you can't leave the victim you're doing CPR on, and you may end up losing the other victim that started to bleed or something that you could have actually helped. All right, so in steps of triage, number one, you would clear all the walking wounded from the scene and tell them to go over to this area where the first aid tent is going to be and have them stay there. And then you go through the remaining victims and check breathing, radial pulse, and level of consciousness. And after you move through all the victims, labeling them, yellow, red, or black, then you would return and care for the most critical red label person who needed immediate care first. All right, so here's our flow chart. Walking wounded over here, they got moved from the scene. And then you check breathing. Are they breathing? If they're not, open the airway. If they do not start breathing on their own, you would label them as black and non-salvageable. If they're not breathing, but you open the airway and they start breathing, then they get red, which means you need to come back to them at some point. All right, so we go back. And the next person, you check them and they're breathing, but they're breathing really fast, over 30 breaths per minute. They get a immediate care label. Next person you come to, they're breathing. It seems normal, under 30, but not too low. Then you check perfusion to the radial pulse. If they don't have a radial pulse, they're going to go to immediate. If they do have a radial pulse, then you check mental status. If they can follow simple commands, they get the yellow category, delayed care. And if they can't follow simple commands, they get immediate care. So if you look at this chart, back up a little bit, look at it, you got our walking wounded because they can walk away. You got not breathing and don't start breathing. You got breathing normally, radial pulse present, mental status good, they just can't get up and walk away, they get yellow. Everybody else gets red. And then you decide who's the most critical of those red and you give care. Sometimes as you go through with triage, if you have bystanders, you're going to use those bystanders. And every person you assess, you're going to have a bystander come sit with them. The bystander can tell you if they start to show new signs and symptoms. If they're bleeding, the bystander can put direct pressure. If you're worried about head, neck, and back injury, the bystander can do inline stabilization. So as you go through, you don't just have to leave them completely alone, but as you go through, you can assign a bystander to each person to do some care with some quick instruction as you keep moving on, and then you come back to the one who needs the most advanced care. All right, and that is it for our lectures.